Hello guys, it's your boy FRANKDFRANKLIN, and once more you're welcome to the channel. On today's episode of the show, we have a doctor who is going to sensitize us on COVID. You're welcome, doctor.
Thank you very much.
Please, can we have a little intro of yourself?
Okay, I'm Dr. Hassan, and I'm a medical practitioner who works with a private practice. Yeah. All right.
So we want you to sensitize us on COVID-19. Like, we need to learn what is COVID,
okay,
how to prevent COVID, the symptoms, so that to keep ourselves healthy.
Okay, good.
So the first question will be, what is COVID?
Okay, COVID actually is a viral infection, so it's caused by coronavirus. And if you are very observant, you notice that is what is keeping the world on a wait now. If you don't know, COVID is ravaging the whole world. There have been different waves everywhere. So you can see that these waves are coming in batches and different countries. So basically, it is a viral infection, and it is caused by coronavirus. Yes.
Okay. So what was the origin of this?
Okay, so back in 2019, you'll be hearing COVID-19, right?
Okay, yeah.
So meaning that it actually started in the year 2019. It originated from China. How it started is just that it happened in China, but we don't know what actually caused such a virus to just go everywhere. Yeah. It's still up to documentation and research on why it even started. But the theory we have actually is that of a virus that originated and emanated from China. Yes, yeah. That's where it started from.
Okay, how can this disease be contracted?
Okay, so basically we already know that the major way it can be contracted is based on a respiratory droplet. We have different theories initially when it started on how it can be contracted, like touching of surfaces, hugging of people, and the rest. But what we have got to realize now is that it is through respiratory droplets, so by coughing. So when it happens, you realize that people will cough, and as COVID can end up transmitting the virus. Little wonder you can see that everybody has to be on face mask until you are vaccinated based on the new protocols, okay, as you already know. Yeah,
there's this fear among the people that has pets, like dogs,
okay,
and cats.
Yes.
How possible is it that somebody can contract this from dogs and cats?
Oh, okay. Well, I think those are just theories and they are myths. Basically, they are not something that are actually, they are not things that really real about transmitting it via animals. There have been no recent or documented researches through which you can get it via dogs or cats. It is still something you can get via human to human. Although the first documentation believed that it must have been transmitted via wild animals, but that is still up to further research to note. But for now, there is no, people can have their cats and their dogs at home and be safe and not feel comfortable. But transmitting COVID via dogs and cats hasn't been fully documented to be a good reason for transmitting COVID now, not that I'm aware of.
Okay. There's a belief that there's a particular set of people that this disease can affect. How true is it? As in, who can contact COVID? Is it like a general signal, a particular age grade?
Oh, lovely. I love that question. So you can say that you can stratify the risk factors based on the age of people in terms of the severity. But it's important to note that everyone can be infected with COVID, even as far back as a child that is just recently born, and as someone who is 100 years old. But then we realize something very amazing about this virus, that people who are elderly tend to get the severe COVID than somebody who is just newly born. You'll be amazed that someone who is newly born should have poor immune system because it's just growing. But then children and newborn don't have that severe COVID. But then in terms of infection, everyone can be infected with COVID. But so there's no particular age group, so everyone can be infected. However, in terms of severity of COVID, you tend to realize that there's certain risk factors associated with getting the severe COVID as it gets, because we have different severity in terms of COVID. So the elderly you'll be more worried about the elderly compared to the younger age group, but everyone can be infected with COVID, so no one can escape being infected. So that's why we are trying to ensure that everyone is safe.
All right, before we go on a short break, is COVID-19 fatal, as in does it kill?
Absolutely, yes. It has killed quite a lot of people. Many families have lost their loved ones. at the point when they never expected them to be. They probably would have thought they would live forever, but then they are not. Even if you look at that of India, which is now a very red zone in terms of COVID now, you can see a lot of family members are losing their young ones, the elderly and those with, comorbid state, maybe diabetic or hypertensive as the case may be. But then it is very fatal, and yes, people are dying of COVID, yes.
Okay, we'll be off for a short break, and when we come back, we talk about the symptoms of COVID. Welcome back, guys. So to continue this segment, we talked about symptoms. So we want to know what are the symptoms of this disease.
Okay, good. So there are basically different symptoms. So what you would naturally see would be things that you have malaria. Malaria, like they are the flu-like symptoms. But a very common one is cough. But not everybody will present with cough. Then you see people who have this catarrh, or they have fever, which is very important. Like you see cough, catarrh, but then outside that, we realize that there are other symptoms that people present with. For example, they could have, loss of smell and loss of taste. You can say that once you come to the hospital, I can't smell, I can't taste. You can say it is COVID until proven otherwise, but there are other things that can cause that. But for now, common things occur commonly. So there are sometimes some people have joint pain, some people have weakness. Sadly, I've had COVID before, so I can tell you that it was a serious thing, having these symptoms and not saying, but no, do not think because you don't have cough, you don't have COVID. Yeah. So cough is not the major symptom or this symptom of COVID, exactly.
All right, you made mention of you having COVID at some point. That's to say, is the disease treatable? Or did you?
Okay, now that's when it comes to the severity, like I said. So when I had COVID, I had a mild COVID. Meaning I had the basic symptoms. I never had to lose my breath or have to be admitted into the ICU or intubated, whereby they would just have to take over my breathing. It didn't have to get to that stage. So I was just treated normally, and trust me, it is a viral infection, and that's the most amazing part of it. You can recover even without treatment. So you can see people who recover naturally without treatment. So meaning the immune system can be so helpful. Although I was on some drugs during that period, but then even with ensuring that my immune system was good, I was able to recover within time. But it wasn't so easy because I needed to be ensuring that I measured my oxygen level to be sure that I'm getting enough oxygen and I don't go breathless, and I was able to recover. Yes, it's treatable, but the treatment is based on protocols. Of course, we won't be able to discuss that because it's a very wide thing, depending on the severity. So we have the mild, moderate, and severe. So yes, it's treatable.
All right, there's this views. I get different views from different people.
Okay.
And some people share their views and they were like, it's not possible that there's COVID. Some people say it's not even real because in this part of the country, many people don't get affected, or we've not seen face to face with somebody affected. If not that you're telling me this, I can say that I've not actually met or seen anybody apart from hearing in the news.
Okay.
So I don't know, how true is this? Is it that in this part of the country that we're not being affected, or what?
I am only alive today because I survived COVID. Yeah. I had COVID, I tested positive to COVID, and I literally got it in Nigeria. I didn't travel out of the country, meaning that I've gotten it in Nigeria. It's not unusual to see a lot of people saying there is no COVID, because if you look at the death rate based on the statistics by the NCDC, it hasn't even gotten to what is recorded in other developed nations like United Kingdom and the United States. Yeah. So a lot of people in Nigeria would assume that there's no COVID at all, because how many people have died? You need to ask yourself. Maybe barely, it's even up to 3,000, or it's not even up to that. You can imagine. Yeah. So, but then the question is why? So what is happening? Why is it that Nigeria is one of those few countries or African nation, not only Nigeria, African nation, maybe with the exception of South Africa? Now, there could be different reasons. A good one, which hasn't really been proven, we could assume that, okay, maybe we're not getting a lot of documentation. It is possible that we're not getting everybody, we're not capturing everybody that has COVID into the number, that the statistics, but that is even negligible, because even if you are not capturing everybody, the disparity between the developed nation and the developing nation like Nigeria is still there. So other reasons could be given that maybe we have a better immune system, or Nigerians are just lucky. But then the question is, this thing still requires a lot of research for us to know why. But the truth is, there is COVID. People are dying of COVID. I work in a place where we manage COVID patients. They get positive for COVID. Yes, there are COVID. So it is like me telling you reality because I see it. It's even from, not all doctors can manage COVID, by the way. But I work in a place where we manage COVID. So the COVID, we manage COVID and we ensure that if you have COVID, most people do survive it. Not everybody would survive it. So it is in Nigeria. But why is it that we are having this disparity with developed nation? I can't really fully say why, but then...
Talking about that, I even got a view not long ago about maybe it's the kind of drugs we take when we are young.
Okay.
Due to the hard labor we go through the sun in the country.
I know. Now, like I said, we have different things that would go on myth. But the thing about science is that science has to be proven. Okay. And it has to go through a research. Like in developed nations, they are always very inquisitive of what is happening and why these things are happening. Some people will give the idea that sun could be a good reason why this thing is, helping us. But I can't fully say it is because we have not done the research to say, okay, maybe it is actually sun. Or maybe because we've grown in a dirty environment and that has built a natural immunity against COVID. But these haven't been documented, because if it has been documented that these are the reasons, probably the developed nation will be looking into it. But take note, please. Now, if you look at the demographics between Nigeria and India, we are quite similar. India is not really a developed nation. And then there's a recent surge in COVID-19 in the Indian population. Reason why we should be very careful, because if we are going to experience what is happening in India, in Nigeria, which is just very recent, it may be very devastating. So we cannot rule out anything, and we just have to take into consideration every preventive measures.
Talking about preventive measure, we want to know what are the precautions or preventive measures you can advise us to take.
Okay, so it's really so basic. One, we need to wear face masks in public areas. Yeah, Nigerians have been able to try, but because nothing is really happening, we've reduced that part. We need to wear face masks, especially with when you know that you've not been vaccinated. Now, things are changing. Research is going on, and most of these things that are happening in developed nations is what we are applying in our developing nation. Some people are talking about vaccination, which we'll still talk about. And then, however, before we get to that, let's look at the basic prevention. Wearing a face mask, ensuring your social distancing. Social distancing means that just you need to keep yourself feet apart, like a feet at least apart from each other. And then that means you cannot, you want to talk to the person who isn't wearing face mask, you want to ensure that you are away from the person. You need to wash your hands, basic prevention. This may not necessarily connote that you will transmit COVID with that, but then it's just normal hand washing, hand washing, wearing a face mask, social distancing, and ensure that you don't want to be exposed to people who are really sick. Yeah. If you think they are sick, just let them go to the hospital to get treated.
Yeah, Nigeria, we're very populated, and actually you go out, you see crowded places all over.
Okay.
So, I don't know, but...
Do you think it's possible?
Yeah.
To maintain social distancing?
That's what I want to ask. To maintain social distancing in this kind of place, because you go out, you see people gathering, you see your friends, and if you say, oh, you're doing COVID, you will be taken as if you...
Yeah, that's why you need to sensitize the public every time. Yeah. Now, it's just natural. If we have the incident that is happening outside the world, like in India, in the United Kingdom, in Australia, in the United States, it's happening in Nigeria, trust me. And they can see that people are just dying. Remember that our healthcare system is not so perfect. It's not so perfect. But then we are trying, at least the government is trying. But then the point is, if we keep thinking that it is not there, and then we end up getting COVID, then that is really bad. So why don't you just prevent it and don't get COVID at all? Yeah. Which is possible. So you can still have, try to ensure that you maintain the distancing if you can. You should.
All right, still on precaution, there's this thing I used to hear or I used to see people, they try beat themselves with alcohol, chlorine and the rest. does that stop spread of COVID?
No, like I said, there is a pattern to the spread of COVID. Initially, we thought, touching surfaces could be a way to spread COVID. And that's why you see a lot of people cleaning everywhere. Yeah, that is just important to maintain hygiene, which is good, which shouldn't be stopped. But since we already know that this can be stopped via, respiration, like respiratory droplets, coughing, that can be prevented. So wearing of, putting on, alcohol or any of those things are just myths. And no wonder we would always have myths going on around in a situation like this. And the reason is this: pandemics like this will create people who actually die of the fear of COVID, like when they don't even have it. So they will end up doing things they shouldn't do when they should actually take the necessary precautions.
All right, Doc, talking about the vaccine. There's this trend on TikTok that the vaccine is a way people are scared to be vaccinated because they feel it's a way they put a chip in their hand or something like that. People are even going the way to try adding magnets and the rest. What's your take on that?
Okay, well, I won't be so surprised that people come with different theories. There are so many different theories concerning COVID-19. So many people will be worried. And sadly, people coming with these theories, you'll be amazed that they've been vaccinated. Do you understand? So there will be theories about, these chips and the rest. But the point is they are not documented. They are just there to scare you. That is one thing, to scare you. And if something is there to scare you, then you know that people will withdraw from getting vaccinated. Even me as a doctor, I had my concerns about the vaccines. But then after reading, that's why you need to know. The only way you can know is by reading. You can research these things on your own. You don't have to wake up for someone to put something in your thinking, to your knowledge, and you just believe like that. So it's not unusual to hear some of these theories, this myth that the vaccine will create a lot of, make you worse or make you like a zombie or a vampire. That is the most amazing part. You hear all these things, but they are not real. They are not real because that's why you need to read. Read, go online, go to credible sites and see what these vaccines are about. Yes, there are side effects, no doubt. But then these side effects are very, very, very negligible. It goes like 1 in a million. So there are side effects to the vaccines, and then the vaccines will not really affect everybody. Even with the side effects, you can be monitored appropriately. That's why when you take the vaccine, the nurse or the person who administered it will say, you experience this, in case you note this, get this. But when you just sit down in your house and watch what is going on TikTok, on Instagram, on social media, on the bad side of the vaccine, you won't want to get the vaccine. So I implore that go on credible sites, read through it, and then see reasons why you should get vaccinated.
Yeah, enough of the bad side. Well, I want to know, why should I be vaccinated?
Okay, good. So like, for example, something happened in a hospital and then we all have to be vaccinated, which is one very important thing for a healthcare provider. I am at a very high risk because I see a lot of patients every day, and it can be COVID, may not be COVID. Now, when you get vaccinated, you get antibodies to COVID-19. Okay. I have been vaccinated, I've checked my antibodies, it is there. So basically what that would do is that it will prevent any severe form of COVID. So it's possible that you may be infected, which is possible, but those are very rare. So once you get it, you'll be mild, you may not even show symptoms, and you'll be fine. So because you have antibodies that can fight it. So what antibodies will do is that when it comes in contact with the virus, it can fight the virus and take it off. That's what the antibodies do. They just help to clear it off. So they make your immune system stronger, so you'll be fine. So the whole reason for vaccination is to get the antibodies to prevent you from severe COVID, and you will be fine. You likely won't die, at least based on the studies. We cannot say for sure how long the antibodies will last, but from studies, it can still last a year or two, as the case may be. But we just have to keep monitoring. Remember, it is a new virus, so we can't say a lot about it. But with the antibodies, you should be fine. Should be fine, and that's the reason why you're getting vaccinated, because you want to develop antibodies to the virus.
Yeah. All right. Thank you very much for that sensitization. Please go and be vaccinated to save me, to save you, to save your children. The world will be free if everybody agrees to be vaccinated, I swear. So we've come to the end of the segment, and if there's any other question you want to know regarding this topic, kindly leave a comment down below. Doctor will be there to attend to your questions, or I can get answers from him. So comment, like, subscribe, turn on post notification to continue getting educative content, because we are all here to educate you on how to live and be safe. Thank you with that.